Hello everyone, I am Dr. Ghanee. I am an oral pathologist. Today I'm going to talk about gum boil or perilous. This lesion is a reactive lesion and is always seen on the gingiva. Look at this funny looking lesion on buccal gum of tooth number 2 and 3 upper right side. Gum boil or perilous is a reactive lesion that grows around a sinus tract. What does it mean? It means maybe a tooth here is infected, the canal is infected, bacteria are trapped in the canal, and that is how our immune system works. Bacteria, they find a way through the bone and gingiva, and then constantly bacteria, byproduct of bacteria, pus and exudate constantly is draining through that hole. We call it a sinus tract. And then gradually a lesion grows in that area, this reactive lesion that we call it gum boil. These are found usually by dentists or hygienists because everything happens very silently. Patient has no clue about it. Patient has no symptoms. This is another gum boil or perilous. One of these teeth is infected and bacteria, they found a way to come out of that area. Pus and exudate is constantly draining there, and that's why this tissue is being formed there as gum boil. And this is another one. Usually when we notice a gum boil, we do not remove it. We check the teeth, which one is the problem tooth. Usually after we do the root canal, if we find a tooth that is necrotic and infected, we do the root canal, or there is a tooth that's a bad tooth and needs to go, we extract the tooth. Usually the gum boil regresses and goes away, and sometimes it becomes smaller and stays there forever. Usually we don't remove it right away. We find the cause and try to treat the tooth first. In this particular case, it looked very unusual. That's why even if I took x-rays, I numbed that area, I removed this lesion, I found that small opening, and I put something that's called gutta percha. And basically when I pushed my gutta percha in, I am going through the same tunnel that bacteria they have made. And pus and exudate is coming out from this area, tip of the root, and it's coming out from that area. You can see in the x-ray. So when I do that, I'm sure which tooth is the problem tooth. And definitely this tooth needed a root canal. So basically, gum boil or perilous is a reactive lesion that usually shows up at the opening of a sinus tract. We always check adjacent teeth and we find out which one is causing it, and we do root canal treatment, or if the tooth is not savable, we do the extraction. Thank you so much for being with me and listening. Have a good day.